Welcome and thank you very much for participating in this new session of thematic discussions within the framework of the Barcelona Forums on Drugs. It's a very special international meeting that will take place in Barcelona from the 27th to the 29th of January 2027. And we are going to share the most relevant contributions of the last 3 years, and it will be presented in order to help organizations, governments, and society as a whole to reduce the problems related to drugs. Today's webinar is organized by Proyecto Hombre Association in collaboration with La Caixa Foundation and the government of the province of Barcelona. My name is Neus Canals. I am the director of Proyecto Hombre in Catalonia, and together with Consagración Jareño, who is representing the International Commission and also is the director of Proyecto Hombre in Alicante, we will have the pleasure to moderate this session. With the title, Welcome to Barcelona, the Strength of the Local Community to Reduce Drug-Related Problems, we want to focus on the fundamental role of local institutions and services and community networks when it comes to responding to social and health realities as complex as this one. We want to also pay tribute to all those who work at the local level around the world, and also share some good practices from Barcelona that we hope will be of interest to you. We want to share good practices that you can make use for yourself and may inspire you. This session will last 1 hour and will be recorded for later dissemination. I'm going to give the floor to my partner, Consa. Welcome, Neus. Thank you, Neus. Welcome. We have the honor to welcome also Giovanna Campello. She's the chief of the Health and Development section of the United Nations Office on Drugs and Crime, UNODC. And she agreed to make an introductory remark for this meeting. Beyond her important positions, she is one of the people with the most knowledge and commitment in the field of drug demand reduction. So, Giovanna, thank you very much, and you have the floor. Thank you, Neus and Consa. And sincere thank you also to Proyecto Hombre, also the Barcelona Provincial Council and La Caixa Foundation for inviting me and for counting on UNODC to open this wonderful event. I know you're probably not the ones who needs to hear this, but it's hard for me not to think about the huge treatment gap faced by people who use drugs and those with drug use disorders. Globally, only 1 in 12 people out of the 64 million who suffer from these disorders receive treatment. And the situation is even worse for women with substance use disorders, for those who use or suffer from these disorders in contact with the criminal justice system, and also prison settings. Of course, also for teenagers and for groups of people that, for multiple reasons, they are in a situation of vulnerability or marginalization. At the same time, it's also important to remember the tools we do have and the practices that have been proven to be effective. We have excellent tools based on scientific evidence to effectively prevent that our children and young people start to use drugs and develop consumption disorders. Yes, it is true that the use of stimulants is increasing in many regions and that we do not have easily scalable treatment options, but we do have good psychosocial interventions that are widely effective. And of course, we have very powerful tools for opioid use disorders, such as opioid agonist maintenance therapy and take-home naloxone. We have, as a matter of fact, the possibility of protecting and promoting the health and recovery of the majority of people who use drugs and those with drug use disorders. This event is part of a series dedicated to presenting good practices in different areas of the response to drug use and associated disorders. And it's dedicated to those who I consider to be kind of silent heroes in this field. Those who help create policies at the local level, those who feel responsible for the health of citizens in their territories, even if they do not have full control over legislation, guidelines, or resources, as well as our colleagues who serve our communities. It may not be the government officials who come to the UN Commission on Narcotic Drugs, but they are often the ones driving real progress, the ones who decide to implement new evidence-based interventions and who listen to the needs of the people who use drugs and those also with drug use-related disorders. I look forward to learning about the good practices that will be presented today and reflecting together on how they can be relevant not only in Barcelona, but globally. UNODC is proud to be an observer of the Barcelona Forum on Drugs and remains firmly committed to supporting this valuable opportunity for consensus and collaboration. So let's work together, and thank you very much. Thank you very much, Giovanna. It's always a pleasure to listen to you. And I think that after your words, that has given us a context for this meeting, we're going to continue with the debate. And today, Iolanda Moragues is going to start. She's head of the dependency. She graduated in clinical psychology and is a specialist in the care of people with addictions and has a career of 20 years as an individual, family, and group therapist. After this stage, she joined the management of social services of the government of the province of Barcelona as a head of the Dependency and Social Vulnerability Care Service, where she carries out her current responsibility. Thank you very much and good afternoon. I just want to thank you, also Proyecto Hombre, for the possibility to participate in this webinar. And I just want to share that we as a government have a basic function and a basic role, and it's that we want to help the organizations and therapeutic consultancies to help the people. We work with social services according to the laws and guidelines given. We have the law of social services that is sharing in the article number 7 that defines the situations that require special attentions, and it also specifies the actions to take. Drug dependencies and other addictions is also included. And it also marks the responsibilities that we have as an institution and is to prevent, to help in prevention. So we have the mission as a government to help the different municipalities. And we also want to create and help different projects in this area, not only with intervention and therapy, but also to help have access to the different support and possibilities that we have. We know that Barcelona is a very big province that needs, of course, as much help as they need, and we just want to help with everything we can, with everything that we can. We also have the will to give all the attention possible to help treat people with addictions. On the one hand, we have a team of prevention and intervention in the center SPOTT, which is the Center of Drug Dependencies that has been working for many years now. And it's a service where we start giving all the help to the different local governments. And on the other hand, we also have project packages with different prevention treatments and prevention help that is disposed for the local governments. For example, the use of drugs or problematic use of and consume of digital media. And also we have protocols for the communities, and we have a team of instructed people that is working with a prevention plan in their communities. We have also have been working together with the teams to take action to make use of these programs of prevention. We also train professionals in the social services in the different areas. We make workshops for families to work and giving the tools and the instructions they need to treat these issues, to treat the problems of drug use and addictions. And we try to work with focusing on prevention. We have also have material that is at the disposal of the different local governments. The last ones that we have is controllers, is something that we have been working on several years already, and we have been working in a new version of it regarding the topic of addictions with the use of screens and the increasing use of screen time. We also have a line of financing for local governments so they can carry out different projects in their communities. And we also have financial aid that can help different communities to develop and to carry out different prevention projects. On the other hand, we have another team of professionals, of trained professionals that are dedicated to help families and different persons that have drug use disorders or behaviors related to drug use disorders or addictions of screens. And we have been working on this for a few years now, and we're going to continue work on this. And these materials and programs that we have is going to be adapted as we go, as we find out more information about this topic. And we think that this phenomenon of the addictions is something that is changing with time, and we have been seeing this already in the past years. It has been adapting, and we have been working with young people since 2005. And in the year 2014, we decided to dedicate time to work with young people until the age of 21. To address these issues. In 2026, we have been incorporating the work related with the problematic use of screens. And now, this past year, we have been also reorganizing our work, and we have incorporated every kind of addiction or addictional behavior. And we initially started working with people until the age of 21, and now we have increased until the age of 30. And then we have decreased down because we realized that the increasing use of screen time is something that is affecting the younger generations. And we want to intervene, we want to help them and try to act at a very early age. Foremost with people younger than 9 years old. and not only with children, but also with the families, so we can help them and give them the tools they need. And this work of prevention is something that has been already published and is at disposal for the different local governments. And it is a service, a free service for treatment for the local governments. Yes, I am coming to an end. And yes, it's not only the people that they have to come to Barcelona to inform themselves, but we have all these different points that have been decentralized, so people have access to the information, also to the places that are far from Barcelona. And there are 2 places where we're working on opening a few institutions to work closer to them, with them. Because we want to create an easy access so people can contact us and work together also with us, because the numbers show us that when you work in prevention, is easier to address this issue than only touching the treatment issue. This is a summary of the work that we have been doing in the area of prevention. And if you have questions at the end, we can treat them then after the interventions. Thank you very much. Yes, I'm sorry. My microphone was muted. But yes, thank you very much for this intervention and for showing us what the resources are of the government of Barcelona and the work you do. Now I'm going to give the floor to Àngels Gutiérrez. She's the president of the Catalan Federation of Drug Dependencies. She has a degree in clinical psychology from the University of Barcelona and holds a diploma in senior business management. She presided over the network Tercer Sector Social of Catalonia for 6 years, and she's currently manager of the ABD Group and president of the Catalan Federation of Drug Dependencies and Other Addictions, from where she promotes initiatives for prevention, care, and advocacy of the rights of these groups. Well, thank you very much for introducing me. Thank you also for Proyecto Hombre to invite me to this webinar so we can share the work that we do as an organization and what our role is as a federation of Catalonia in this topic. Thank you for everything that you have organized with the Barcelona Forum on Drugs, because it's very important to us. And drug addictions, as we know, is something that we have been battling with many years, and there is still a lot of work to do. The Federation of Dependencies and Other Addictions, of Drug Dependencies and Other Addictions, I just want to emphasize that we are organized in 20 small organizations in the social sector, and we're all engaged together as a federation already more than 40 years. And we organized to work in the topic of drug dependencies. And our initial mission was to build a working relation with the local communities. The federation represents over 2,000 professionals in different areas. We have also volunteers, and we know that volunteer work is crucial to carry out our work. And we have many, many hours of attention throughout Catalonia throughout the year. We carry out different activities, such as we work with commissions of gender and young people, sport and justice and families. And we also have different modules of intervention. And this model of interventions is something that defines us as a federation. And we want to enlarge this model because we have three basic pillars. This model of intervention is integer because as a whole is an intervention psychosocial. It has different areas from mental health, physical health, social health, familiar health. And it's also a model of intervention that we built that goes through different areas, that includes different areas, because it promotes the social inclusion, participation of the communities, and also the different support networks that take part in this. And we also call it integrating because we coordinate with other different networks in the health area and social area, so we can work supporting each other. And this framework that gives us this model of intervention as a federation is very important to us. We carry out different activities in a specific platform, for example, the assemblies and the meetings that we carry out every month. And we also have a plenary session once a year where we talk about different topics. And we also have a different kind of meetings that it's called the walkthrough meetings, where we get together as a group and we carry out different specific activities as a collective. One of the activities that we do as a federation is the Agora. In the Agora is something that we carry out a few weeks back for this year. And we talk about our best practices from the different entities, and we pick one of them so we can present them in this session. And what I want to share concretely here is that the Agora is a platform. What I want to say is that this platform is important for the federation because Agora as itself is a best practice. And related to this, I want to mention the 6 best practices that we have in this Agora model of intervention. What we understand as a community is that the community has to be attentive and focus on prevention, collaborate in the topics of treatment, and help people to reinsert themselves into their social circles. A few best practices that we picked out and that we have presented is something that we can make use of, or we can continue to learn, and where we have been adapting with. We have also different challenges that we face. And we have been working together with therapeutic communities and different areas that address this topic. And for example, one of the examples was a challenge in sport where we can help people develop further in their sport goals. And we also have individual goals, but also goals as a group. We also have a program that helps to reduce risks. It's an online consultation that can take place between one people from a worker and one patient, and we can help them. And this method, this way of working, is something that can reach many people, many affected people. Then the entity La Ravalera also presented their best practice. And they are specialized in construction. They have made carry out different workshops throughout the week and also on the weekends. And their concept is to build up a neighborhood from the marginalized people. You have 1 minute, Anjas. Okay, yes. And AFATRAC also presented itineraries for young people to help them insert themselves in their working life. And in different areas like in gardening or in different stores, or to help them gain artistic experience like in the theater. And last but not least, the team of Bonjoui presented that a way of prevention is to work together in the reduction of harm for the communities. And what I just want to share lastly is that I want to use this space to share this message is that we as a federation work a lot regarding these issues, and we need to talk about drugs. We need to talk about drug dependencies. We need to talk also about other addictions, behavioral addictions, because otherwise we would be only talking about things that are not relevant. We need to talk about drugs and dependencies, and it doesn't matter whether you classify it as a mental health issue or something else, but we have to talk about this and we have to help people go through these issues. We have been working on this over 40 years now, and we need to address these issues with training and with the proper resources. And what I want to emphasize is that the drugs are here. We have to also talk about the stigma related to it. And we have to treat this with care, because the different strategies that we have is that we don't have to like sweep them under the carpet. No, we have to address this issue loudly. Drug dependencies are relevant, are affecting our population, and they are related with several health issues as mental health, social health, and so on. And I just want to thank you for inviting me to this platform and to giving me the space to talk about this. Thank you very much. Thank you, Anjas, for your intervention and to share with us your good practices. They're all very different, but very complementary to each other. Also, congratulations for the work that you do as a federation. We know your work you do, and we're very pleased with it. And then we're going to give the floor to Cristina Delgado. She's a coordinator of the prevention programs of Proyecto Hombre in Catalonia. She's a trained psychologist and holds a master's degree in addictions from a biopsychosocial perspective, with 12 years of experience in the sector. And today she represents the Peripherics network, the most important local network of institutions specialized in drug use prevention. You have the floor, Cristina. Well, good morning and good afternoon to all of you, whatever you're watching from, you're tuning in from. It's a pleasure to participate in this webinar and to share this experience. I just want to say, firstly, thank you, Proyecto Hombre, for helping me participate and to share my experience, where we can share how the action experience of the local community, it can be key to reducing problems related to drugs and other addictive behaviors. Today, I want to introduce you to the experience of the Peripheric Network, a network of local entities and organizations in Catalonia that has been working for more than 2 decades in the field of prevention, health promotion, and community strengthening. We started in 2001, and we aim of responding the two major challenges that are still relevant in many territories. One of them is the professional isolation of technical people who work in prevention at the local level. And on the other hand, the lack of coordination between the different levels of public administration and social entities. Since 2001, the network has grown and consolidated. And today it's made up of city councils, social entities, and public administrations, and acts as a space for exchange, reflection, and joint action. And what my colleagues explained before is that it is like a joint connection of networks. And We believe in prevention as investment in the future. In 2011, in a context marked by a severe economic crisis and budget cuts, the Peripherics Network promoted a joint manifesto with a clear message, and it was that we claim the promotion of health as an investment in the future that allows us to avoid multiple negative consequences for the people and society. So our position is based on a fundamental idea, and that is to invest in prevention because it's profitable. International health organizations have pointed out that every euro invested in prevention can mean significant savings in the future health, social, and economic costs. And on the contrary, reducing resources in prevention generates much higher costs in the medium and long term, both for public systems and for communities. The work of our network is based on a series of principles that we consider essential to other contexts. We have the interinstitutional coordination, and when we manage to coordinate, we avoid duplication and fragmentations. We also make use of knowledge of territory and proximity as a basis for interventions adjusted to the local reality. The co-responsibility with citizens, because we think that promoting the active participation of the community is key. And the vision of the prevention as a public policy sustained over time, because it's not specific or isolated actions, because when we look to it as a whole, it all has the same objective. In the recent years, at the local level, we have detected a series of risks that threaten the sustainability of the community prevention. We see a decrease in human and economic resources. We see a reduction of educational and community programs. And we see that decision-making takes place without a prior impact assessment. So now we have been really taking action to evaluate what we really need. And the progressive loss of the strategic role of the local level, despite its proximity to the cities, because we're at the same time far and close. And these risks are not exclusive to our territory and can be recognized in many other international contexts. And from our experience, we also want to highlight some good practices that have been proving effective. And we know that the Peripherics Network itself is a good practice, but we just want to share in detail where we are taking action and what we're trying to do. One of the best practices is to create a general vision, because we have been working with prevention plans at the local and territorial level to build in a participatory way and adapted to each community. We have a stable networking which connects health, education, social services, youth, and community entities. And continuous preventive interventions not limited to specific campaigns. We create training and technical support spaces for local professionals, reducing isolation and improving the quality of interventions. And yes, we also work with program evaluation, using available evidence to improve and make informed decisions. Yes. We also want to help people take active participation of the community, especially young people and families and local agents that are accompanying these people. And if we go into specific best practices at a local level, we can see that in some locations there have been psychoeducational measures that have been taking place when drug use is detected on public roads in minors. We also have local guidance on counseling services for young people and their families for non-addictive consumption in order to avoid generating an addiction. on the long term. And this intervention is also important in party spaces to reduce risks and damages. Detection and referral protocols in schools are also important, and we want to also generate community tables with the different agents who act during the night. These practices have been made possible to strengthen our community and to strengthen the community network and to generate more effective and sustainable responses. So this has been my contribution to this webinar. Any doubts or question you have, I will be happy to be able to answer it. Thank you, Cristina. Thank you. You have given us 1 minute. And we want to make use of this minute. You are able to write questions in the chat. Thank you, Cristina, for your intervention and for reminding us that everything that we do in the area of prevention is an investment in our communities. And of course, we're also investing in the young people. And of course, it's very relevant for the work we do also in the matters of treatment. Thank you very much. We're also going to continue with Luisa Maria Conejos. She's Deputy Director General for Addictions, HIV, STIs, and Viral Hepatitis of the Government of Catalonia. She's a public servant with a solid clinical background and extensive experience in the field of public health. Clinical psychologist from the University of Barcelona. She has a master's degree in addictions from the same university. She currently holds the positions of the Deputy Director General, and throughout her career, she has worked in the planning of specialist programs in the field of social welfare, including the City Council of Lleida. You have the floor, Luisa. Thank you very much, Consa. Thank you also to Proyecto Hombre for this opportunity, for organizing this webinar, and also your presence, participation, Giovanna, Campello. It's very great. And also my colleagues that presided me. I feel very aligned with you, and I appreciate your work. And thank you everyone who is watching and participating from the other side of the pond. Good morning, good afternoon. And what Cristina also mentioned, well, I come from the peripheral work, and what Consa said is that I want to share with you what has been happening in this place of proximity, where the different policies are applied in our society. And we are here in the government that has a holistic view of this issue. Catalonia has 4 provinces, and one of them is Barcelona. And all the provinces have the same capital city, but I just want to share that with you, because before we were talking about the province of Barcelona and what they have been doing, and now there is the organization, the government organization of Catalonia, which is it's bigger, and it's like a federal government. And we work with the other autonomic communities that are a part of the Spanish government. And we have the capacity to create legislation in the matters of prevention, of drug use prevention and treatment, the treatment of planification of resources for preventions, for drug harm prevention, and also for monitoring and alert of the use of drugs, so we can know what is really happening in our communities, in our cities, regarding the consumption and the resurface of different drugs and drug types. So we can act accordingly based on the data that we collect. We are a center that collaborates with the World Health Organization, and we have been collaborating with them to create policies regarding the consumption of alcohol and the health impact that it has. We have also been reinforcing and impulsing policies that creates the answer that we search for in matters of treatment prevention. We want to focus also on what has been happening at a local level. We want to share our intense work from the last years, our best practices in the matters of prevention, and we want to help the different local agents that have been working in different areas of Catalonia in the areas of prevention and intervention. And we have been accompanying them in the area of quality and best practices. We have also been evaluating the different programs they have been carrying out. We know that there have been difficulties in matters of application and the efforts that relate to this. We have also been developing the SIPA. It's a space that focus on mapping the best practices that we have available in the federal government of Catalonia, and where we can make use of them the best way. Because sometimes when we think about best practices like the action plan protocol, when we detect the cannabis consumption in public areas, or the measures, therapeutic measures that have to be taken into account when treating families and young people. And all these protocols come, of course, from the local governments, and they address this necessity to work together as a whole to address this issue. And something else that I want to share about best practices is there is a program, we school, there is a program, a Vespertine program that we apply in the different local governments of Catalonia, where we help affected people, or the Connect program. It's a familiar program that helps families with young children. And what I want to mention besides that is that the work in the area of prevention is something that concerns all of us. It's a joint responsibility and concern, because we have to create a system that allows us to carry out these competencies, these skills in this area effectively, with the financing that we need and with the help, all the help that we can get. Because preventing, it's also focus and on having the work that the equal work for equal possibilities and equal information for every local area. And I want to also mention that my personal work is also have been included in the work that we have as a government, and other different elements in the area of treatment. I want to share is that we have been working in different models. As I mentioned before, we want to be an example of how we can develop effective modules for mental health in the matter of addictions, because we don't only want to offer attention to affected persons that have this problem with addictions, but we also want to help people with mental health problems, and we want to create the services that the people need. And we have been already carrying out these programs, specifically in CAST, and we have been gathering all the best practices to create a model for the whole region of Catalonia. We want to create also a model to address behavioral addictions and also to create the attention that young people need, because there is a project of functional needs that we have and want to take the momentum to help this project to help people that have problems with drug dependencies. In the protocol of pediatry, also includes important information for addressing this issue, and also the support that families and young people need. Okay, 1 minute. Yes. And according to the treatment, okay, what I also wanted to mention is that we in Catalonia have a system of harm reduction that we have been working on for several decades. And it's a model that is based on putting the health in the front row. And it doesn't matter whether it's a behavioral addiction or a drug dependency addiction, but we have been working on this so it can be reached also to every local government that needs this. I also want to highlight that it's important to participate in every organization and seminar relevant also in the current work that we have been doing with the different NGOs and Proyecto, and of course also with the Federation, with the government of Barcelona and the other local governments. We want to work together with them, and also the Commission for Drug Dependencies, because we think that it's important to work through different organizations to support each other and to improve our work together. Thank you very much again for being able to be a part of this webinar, and I hope that I can answer your questions if you have any. Thank you very much. Thank you, Luisa. We see that we have many other topics to talk, to address, but I'm very thankful for everything that you have shared. And okay, we have time for 2 questions. It's a question for Iolanda. So what is happening with people older than 30? How can they access to these programs? Okay, the government of Catalonia has a network of services and resources and different centers for attention for adults throughout the whole Catalonian territory. And the idea of SPOTT is not to cover a space that has already been covered, but to give a space for younger people, for minors that don't have the whole broad support information that the adult centers have. And we know that there are certain addictions that are not going to be addressed in centers from the network. But we know that there are different centers specialized for people older than 18 and others younger than 18. And in year 2014, we decided we didn't decide to stop treating adults. We just wanted to focus on the lack of services that was there for minors, because there were minors that were affected and they didn't get any attention. And there are other local governments that are, of course, trying to have a joint attention between adults and young people. But yes, we see different addictions that affect different groups of people. So we think that it's important to cover these kind of services for the group of the population that has less resources. But from the age of 18, we offer different centers of attention to treat drug dependencies throughout Catalonia. Thank you, Iolanda. A second question. It's addressed to all of you. You may answer however you like. Does the judicial power participate in any of these programs that you have mentioned? Iolanda, yes. Yes, I want to answer. For example, when we design a plan and a local government asks us to plan, to make a plan for prevention, a program for prevention, we try to gather people, experts, and we try to talk to every resource that we have, every professional that can help us carry out the plan. Of course, law enforcement, police, and the judicial power, it's only involved like on the framework, but they are not really incorporated in these projects at a deeper level. But I don't know, Luisa, if you want to share. Yes, well, we work together with the Department of Justice, and we see that the attention on drug dependencies in different prisons is something that is very important to us. And I see that Angels wants to address this topic also. I commented yesterday that I talked to Angels and Felisa that we wanted to talk together for a project for people that, for example, had committed a crime because they were under the influence, and how can we help people that are affected by this and create like a center or a first step to help these people. And that's something that we talked about with Andres yesterday. Maybe she wants to add something. Yes, I want to add to this because you already explained this. But yes, in the Federation of Catalonia, we have this Commission of Justice, and in the plenary session of these years, we're going to talk about justice. And it's not only open for entities from the Federation, but for other entities as well. And we have always been worked with the Justice Department because we know that there are many, many drug users that have problems with the justice. And there have been studies, and we know that there are exact data that relates to this. But we have been working as a federation to have a specialized service, for example, that in Madrid and in other countries, in other communities, there has been this already. And it's a program called Sahiat, where we can help people and avoid them going to prison, but to make use of another kind of treatment to help them. And we can present this to a judge, for example. But of course, it needs financial aid and support because when you put a person into prison, it has a high cost. But when you help a person treat their problem, you can not only reduce costs, but also help treat the problem of the person better, because it is an important problem to address, drug dependencies. And we want to help the people to get better. And we have been working together with the Justice Department, and we only have positive experiences. Thank you very much. Cristina, you want to say something? Do you want to answer to this question? Yes, well, not really from the position that I am taking today. But we, as an organization of Proyecto Hombre, we want to make an activity once a year with the different judges of the city. And we want to talk together with them and explain them what we do as an organization so we can humanize people and to remove the stigma of people that suffer from drug dependencies. So we can, we know that there are many judicial processes that they go through, and we want to just make them aware that this is a real issue and we want to help the community with it. Well, thank you very much. Thank you. We want to gather all questions that you have, and we're going to sum them up and give them to the participating here today. And we will send you a handout with the answers. Thank you very much for everything that you have shared. Thank you for everyone joining us today from whatever you're watching from. These have been really nice topics, and we just want to say thank you to over 100 people that have been connected, speakers and technical team. And also thank you to everyone, Giovanna, Iolanda, Cristina, Anges, Luisa, thank you for your interventions. Also, thank you for the technical team that has made this possible. And thank you also for your participation. And also, we're going to inform you soon of the next thematic discussions.